Hi, my name's Ree. I am the program coordinator here at the Integrative Mindfulness Center. I have my Bachelor of Arts degree majoring in psychology from the University of Manitoba. The Integrative Mindfulness Center is a child psychotherapy support program that is passionate about helping children and families that suffer from psychological issues such as trauma, addictions, concurrent issues, attachment issues, and behavioral challenges. We believe strongly in a holistic biopsychosocial spiritual value. We're culturally sensitive with diversity, such as indigenous land-based knowledge, and we're a family-centered approach so that together we can help transform the lives of children. Our intake is open not only to professionals such as caseworkers or family physicians and pediatricians, but also to individuals, families, and other community members. Our assessments are a formal time with the therapist where standardized tests are used to determine a child's level of function and abilities. So after the assessment with the child has been completed, a meeting with the parents are scheduled to discuss these results. And the results, along with the parent and child's input, will then determine the child's treatment plan. And then a document with these results of the assessment are provided to the parent at the time of the meeting. Consultations are basically an informal time with the therapist where we use parent-child interviews and clinical observations to determine the needs of the child, and a treatment plan and program suggestion are then discussed at this time, and the next steps will then be determined, and a written document is included with consultation. With treatment sessions, these will be determined based on the assessment or consultation with the child, if it's appropriate, and the family. Treatment sessions can be 30, 45, 60 minutes in length, just depending on the child's ability and age. Frequency of sessions are determined by the therapist and the family. In these sessions, the therapist then uses activities and different strategies in a play environment to improve the present function and the skills of the child.
I'm Kathy Jensen. I'm the Senior Therapist and Consultant for Child and Family Therapy. I have a background in individual, couple, and family therapy. The majority of this experience has been in rural and northern settings, both in Ontario and Manitoba. I have taught at both the undergraduate and graduate levels, initially in Winnipeg at the Faculty of Medicine, Department of Family Medicine, and then at the Faculty of Social Work in Thompson, where I was the assistant professor and then the program director for, I guess, approximately seven years as the program director. Most recently, I spent 17 years at the Thompson Clinic in the Northern Regional Health Authority, doing individual, couple, and family therapy there. And I retired in 2018, and now I have returned to work part-time. We use a collaborative, collective therapy approach and innovative child-centered practices in order to overcome the obstacles that children present with, and in order to remove those obstacles so that children can excel in all areas of their development. We have a dedicated team of qualified therapy professionals that provide specialized therapy services. Our therapy team consists of Child Integrative Therapy, short-term family-centered program, a comprehensive therapy assessment and testing, Therapeutic Group, loss, grief, trauma support, Therapeutic Family Systems Work, Child and Family Therapy services, and we are also supported by an administration who works really closely with our families to provide integrated services, information, and support.
Hi, my name is Mary Azier Lobman. I'm originally from Opaskwayak Cree Nation. I have my degrees in social work, master's in BSW. I'm also a registered social worker. I work primarily with families and youth, and I've been in the field now for 25 years plus. The areas of expertise that I work in are trauma work, grief and loss, learning to forgive. I do a lot of workshops in these areas. I also do sharing circles, healing circles, and do a lot of one-on-one counseling, family counseling.
My name is Carl Lobman. I want to share with you some of my skill and areas of specialties. I am currently employed with the University College of the North as a cultural coordinator. I graduated from the University of Manitoba with a Bachelor's of Arts degree, majoring in sociology and minored in Native Studies. I have worked in the social services, addictions, and employment fields for the past 35 years. I'm qualified in addictions, employment, and career counseling, teaching, facilitation, and training in treatment centers with youth and young adults. I have been involved in traditional Aboriginal culture for the past 38 years. I am a pipe carrier, sun dancer, and help with traditional activities at ceremonies. Thank you.
Hi there, my name's John Coop Harder, and as a counselor I bring over 20 years of experience supporting people at overcoming trauma and trauma's good friends, such as mental health issues and addictions. A strong influence on my understanding of these issues comes from my work with male survivors of childhood sexual abuse. Another strong influence on my work has having been lived and worked in diverse settings, such as Colombia, Albania, as well as Northern Ireland. As a trainer, I've had the opportunity to visit numerous communities across Canada, including various indigenous communities, both rural, urban, as well as very northern. All of these experiences have taught me that people are resilient. There's numerous paths to healing, and problems love isolation and silence, and health requires connections. I have a strong interest in working with youth and families, and a special interest in working with boys and men. I look forward to working with you. Thank you.
It's a pleasure to meet you. My name's Don, and I am a CYC. I've been a CYC for almost 25 years, and I've been working in children's mental health for that entire time. The majority of that time has been spent working in children's residential treatment for an accredited children's mental health agency. I've also had experience working in treatment classrooms, and I'm currently working as an intensive in-home service worker. Through my work, I generally utilize lots of play, lots of experiential education, and relational work. I've got some training in CBT and DBT, as well as DDP.
Okay, some of the conditions that we service. We do a lot of work with trauma and attachment, grief and loss, post-traumatic stress disorder, intergenerational trauma. There's a lot of anxiety and depression that we see, addictions and substance abuse, and the impact of those on families. We try to work with a lot of family systems issues, and we try really hard to support family and foster parents. We look at all levels of autism, learning, kids with learning disabilities, mental health issues, some of which I've already mentioned in terms of the anxiety and depression. But we might see obsessive compulsive disorder, oppositional defiance disorder. We see kids with attention deficit disorder, attention deficit and hyperactivity disorder. We see sensory processing issues, developmental coordination issues, developmental delay, learning difficulties, and a number of other neurological disorders. When we see kids, quite often might end up with kids, because we go deeper and we deal with more in-depth issues when we're working with kids. Sometimes kids will resist the therapy. They'll pull back, they'll not want to come. And chances are that means we've hit something that's really important for that child. And they're not really sure if they want to proceed. They're kind of scared to do that. And part of therapy our big part of therapy is bringing up issues that kids find really difficult to talk about. And the reason why those issues get pushed down and they're not talked about is because they're painful and they hurt. And they challenge kids' concepts of families, concepts of themselves. So quite often when we hit those moments where we're asking kids to dig a little deeper and to surface some of that hurt and pain, kids will pull back. They'll suddenly not want to come and see us. They'll suddenly, therapy isn't working, I don't need this. Sometimes we just need to give them some breathing space and then encourage them to come back. Because that's usually the next step, because that's when we need to get the commitment to, hey, let's go a little further with this.
By visiting our website, you can find our contact page, phone numbers, emails, fax, and we strive to meet the needs of most children so that they can perform at their highest possible level. The Integrative Mindfulness Center also offers a variety of different training workshops. So clients who undergo family or individual adult sessions, you can be benefited by attending things such as the Attachment Parenting Skills Workshop, Loss, Grief, and Trauma workshops, anger management and coping skills, domestic violence and intimate partner violence workshops, grief and trauma resiliency, and basic integrative mindfulness training programs. If anyone has any questions or if you require any further information regarding anything presented in this video, please don't hesitate to contact us. You can reach me at 204-939-0647 or coordinatortherapy@gmail.com.